Welcome to the Global Public Health Revolution, the podcast by the AIDS Healthcare Foundation, where global public health meets bold advocacy and game-changing marketing to spark real change. When the AIDS Healthcare Foundation set out to launch this podcast, the goal was for it to be bold, audacious, transformative, and inspiring, to take on global health like never seen or heard before, particularly in an era of overlapping shocks and unpredictability. And wow, what amazing episodes we have had, if I must say so myself. So today, as we draw the curtain close on season 1, I'm joined by some amazing colleagues who have been working behind the scenes of this podcast with me. And today we would reflect on this inaugural season and discuss plans for the future. Hello, friends. So I have Dennis, Nazarov, Cyan Clardy, Olivia Taney, and Brian Shepard. Good to have you all here.
Thank you, Kemi.
Hi, Kemi.
Yeah, we're going to be chatting about our first season. And I would say for me, it's been amazing. And, we're looking now at season 2. Where do we move from here? And knowing that where public health stands today at a crossroad, we need to have more of these conversations. So I want us to just take a look back just a bit, because you all have been behind the scenes, working from episode to episode to get us to where we are. So you must be very proud of yourselves, right? That we've come to the end of season 1. Let me just start with Dennis. So when we set out to do this podcast, what did you think was going to happen? And did you have any surprises at all?
It went a lot smoother than I anticipated. Getting a podcast off the ground from zero, I thought we'd have a lot of road bumps along the way. Big credit goes to our wonderful host. I think the host is what makes or breaks the show. So, Kemi, I think you deserve a lot of credit for making the process so smooth. And then also, big thanks goes out to Resonate, our production agency that helped us put this together. We came with the idea and not much else. We had a host, we had the idea, we had the mandate to go out there and tell these stories. And Resonate has been along the way, hand in hand with us. So I think that really made it all come together.
That's good to hear. Did you have any surprises at all, or no?
I think the biggest positive surprise was just how dynamic the conversations have been. Kemi and I, when we first started talking about the podcast, we kind of deliberately wanted it to be not boring, and to look at public health through the lens of marketing and advocacy to make it interesting and dynamic. And I think we've really achieved that. Having just recently re-listened to all the episodes back to back, at no point did I feel like it was boring or that somehow the conversation was too technical. So I think that was a very positive surprise.
Cyan, do you feel the same way as Dennis? Or what are your own sentiments?
Yeah, my thoughts were a little more from the content perspective of how throughout the through line of the episodes that everyone thought that it was so easy to get out there into the community. And in the youth episode or the men's health, going to the barber shops, this idea of bringing the services to the people, especially when governments and other systems are failing, that they made it seem so easy that the community just trusted them and accepted them. But I don't think it's easy to build that trust. I think it's hard work and it takes a lot of time. So I guess I'm surprised that they didn't dive deeper or acknowledge just how hard it is to connect to strangers who you're trying to get to take medications or reframe their outlook on health or take your health advice. They just get out there and do it. That seems such an easy call to action, but it does take work and effort.
Yeah, like they say, it takes a village. Brian, I see you wanted to share something on your own reflection.
When we first started talking about this, we were like, Global Public Health Podcast. How are we going to make this exciting enough that people want to listen and reach the people we want to reach? The season, as expected, covered some heavy topics. But I think kind of tagging along with what Dennis was saying, it was a little surprising how engaging and accessible it felt. Because the issues are so dense, right? And Kemi, you did a wonderful job of breaking them down, making it very conversational. And our guests and you have a real talent for breaking those complex issues down in ways that everyday listeners can actually follow along with. And so it doesn't feel like they're in a lecture hall or in a satellite session at a conference.
I know that was one thing we talked about, because how easy is it to get like a really heavy topic, make it get the attention of those who make the decisions because they're a target audience for us, but also make it relatable enough that someone in the community as well sees some lessons from it. And I think we've found a sweet spot around that. Olivia, what would you say?
Yeah, I really think that I have to echo Brian and Dennis on this, because this was the first podcast that I've ever worked on, and I wasn't really sure what to expect. And going in and joining AHF actually around the same time that we started working on it, I expected it to be a little bit more of those technical topics, for it to be more policy focused, but we were able to, and especially Kemi, able to just engage the guests and not just talk about, the policies, the systems, the strategies, which we do touch on, but also the guests share their lived experiences, they're sharing challenges, and they're able to laugh along with it. And it brings such like a human perspective to these problems and to these issues and solutions that it makes you want to keep listening to more and really be able to understand it coming from someone who doesn't have a large public health background.
Yeah, I'm going to stay with you a bit because you started us off on the guests and the topics. Dennis also mentioned the fact that it was very dynamic. So I want to ask you, when you look back at all 6 episodes, which would you say resonated with you the most and why?
To me, episode 6 really stood out to me. I kept going back to it and re-listening to it and thinking more about it. Working in communications, I just connected with the way that they were able to highlight the creative marketing. And especially what really struck me is Jason mentioned how creative marketing isn't just something that's nice to have. It isn't like a luxury for organizations, but it's a necessity that we have to have because we need to find the way to reach our audience because it's crucial to our mission. And that really struck me.
Thank you so much for sharing. Who else wants to share in terms of which episode stood out to you the most and why?
All of them were great. I loved hearing the youth voices in episodes 3 and 4. Along with Olivia, I also loved hearing Dr. Sam and Jason talk about all the actions that are going on and what the Just Use It campaign really meant for AHF globally as far as condom promotion. And obviously, the first episode with Michael Weinstein, he's got so much experience and wisdom in the public health space that he really ties it all together so well that I think if anyone hasn't listened to that one, it's a great start for the first season of the podcast. And it really ties it all together, everything from the early days of HIV and AIDS to leading up to the COVID-19 pandemic and what AHF has done all along the way to address those issues. But that said, I think episode 5 on men's health really stuck with me. I played basketball into my mid-40s, so having Norm Nixon on, a former NBA player, using sports analogies to talk about health, it really made sense, especially the whole fourth quarter of life. As men get older, they tend to want to slow down with health promotion. So that stuck with me. It's an important time to step it up for your health. So that was relatable. And now that I'm 50, it was a little offensive too, just because I'm in that category now. So, but in a good way. And I've met and interviewed Trevor before from Uganda, so I already knew how strong of an advocate he was for young people, and obviously young men fall in that category. But hearing them talk about how meeting men where they are, whether it's, like you said before, whether it's bringing former NBA players to barbershops and bringing services to them there, or workplaces in Uganda where it's largely male male workers. And we do that in a lot of different places, not just Uganda, but bringing services to them and treating health as strength versus weakness, I think really resonated with our male listeners. And it's great to share that around the world.
Thank you for sharing, Brian. And if it makes any difference, you don't look like you're 50. So, and yep. And the more you talk about this, I see your passion on men's health. So I'm guessing that, we talked about the need to have like more male-driven dialogue or dialogues driven by men and conversations, both from older to younger men. So we'll probably sign you up for when Norman and Trevor have that conversation so you can join them on it. But yes, that's an important one on being in the fourth quarter and what we do about that. Dennis, what are your thoughts?
I think for me, the highlights were the episodes featuring young people. So the 2-part episode with the public health youth advocates, and then also the episode with Norm and Trevor. It blew me away how articulate and passionate these young leaders were and how well they can describe the needs the young people have and what they would like to see the leaders do on public health. And it gives me a lot of hope that the next generation is so engaged in shaping global public health. I think, things with leaders like that coming up, I think things will be okay.
Yeah, it's a good way to go to Cyan. Yes, things will be okay. I liked that episode too with the young people. And I would like that the world tap into that more because they have a lot of ideas that can help us even as we try to reshape global health and reach more of them. And even when we think of the rates of STIs and HIV even among that group, it's a critical group. I see them as critical actors in the response, not beneficiaries that they're often treated as. I'm hoping that that episode did shine that light and even this conversation we're having. Cyan, I saw you nodding your head in approval.
I really liked the youth ones too, and I'll also touch on episode 2, tokenism. With the youth episodes, I think really hitting on the importance of comprehensive sexuality education, and especially in schools, because I think a lot of schools still avoid CSE or sex education in general, or if they do have it, it's reduced to something really watered down or politically driven. And so I think when we are promoting sex education, we need to emphasize what type of education. We're not just talking about education as a tool and that's it. We're talking about education that reflects real life, real bodies, real identities, and real risks. And I think if schools aren't recognizing students for who they are or providing mental health and sexual health support alongside physical health, then we can't be surprised when certain health outcomes worsen. So I'm really proud of our youth advocates and people who are out there doing that type of work and advocacy. That's really important to move the needle. And then the other episode on tokenism I thought was fantastic. And, having it not just a seat at the table, but an equitable seat at the table. And I think what AHF does really well, and especially with the new Global Public Health Institute is, we're making our own table and, we're making our own rules and, making sure that representation isn't performative. And I think reclaiming that power to the people aspect is that revolutionary idea that needs to happen. That's part of the global public health revolution.
Yeah, as you speak on that, I'm thinking of some of my aha moments, like light bulb moments, and I'd like for you all to also share. And the bit about there's no public health without the public, because sometimes when I think of public health, I still have it in mind to make a T-shirt or a placard out of that. But I think sometimes we forget that. And then also when Nam talked about the fact that you never be too busy to take care of you, something like that. I think that's something that it would sit very nicely in an office, on a desk somewhere, just as a reminder or even an affirmation when we wake up. So, or every day of our lives to just take our health really seriously and, continue to do the work that we do when it comes to public health. So I just wanted to know, did any of you have any aha moments, even in these episodes that you talked about? Maybe we'll start with Dennis.
Yeah, I think there were 2, and this is sort of big picture. I think one is it was so refreshing to have positivity. in the platforms, in algorithm-driven platforms, what rises to the top is controversy, conflict, bad news, all of these things. And here we had so much positivity because we focused on not just what's bad or what's going wrong, but hearing voices from people on the ground who are actually doing something about it. And that, to me, is one of the biggest values of this podcast. And the other part of it was, there's been a lot of talk about the decline in journalism, and, funding for meaningful journalism is going away. There's not as much interest in it, again, because of the algorithm-driven models. And I think this is a small answer to that problem, is we are delivering the information, into the public sphere from the perspective of people who would otherwise not get that spotlight. And I think if we think of podcasting in that way as a form of journalism, which it certainly is in this case, I think that's an incredible value for the general public to hear these voices. So those are my two aha moments.
Thank you. Olivia, do you want to share?
So one light bulb moment that kind of struck with me was going back to episode 6, hearing Jason and Dr. Sam talk about how they come up with their creative messaging for sexual health, and just the ability that people need to be able to see themselves in creative marketing to resonate with them. And the ability to be able to do that, especially in sensitive areas, like Dr. Sam was mentioning with populations in India, and how much goes into these campaigns was really inspiring to me.
Yeah. And when I hear you and Dennis speak, because I feel like it still has elements of communications in it, and whether it's journalism or even the media. And that's something we've also seen in health. People often say, oh, the media is not really interested, or the topic of HIV has been long gone. But these are also opportunities to not only speak on the creative side, but also the role that media channels or communications can play when we talk about public health and even journalists. And those are things that AHF invest in as well. You're seeing the media as partners. So I like that you both are bringing that out. And when Dennis also referenced, this is a channel. This is a way, when we think about funding for journalism or even media engagement around health, this is also an avenue. And I think somewhere in our future, I know we'll talk about it, we have something around, the role of media and comms. So that's something I'm looking forward to chatting about. Cyan, any aha moments for you?
An aha moment for me and the through line for a lot of the episodes was just this idea that you just have to start showing up. Whether you're a youth advocate, a creative, doing billboards, a public health lifer, just someone starting out in the space. I think being out there in the community, listening and showing up, and sometimes creating that room where it doesn't exist yet, and then inviting people to your own table. I think that's the next wave of public health change that can happen. And especially that we heard with that last episode with the creative marketing, these topics don't have to be scary. They can be really fun. So I think everyone should just have fun with it. And talk to your peers in your community in a fun way.
Brian, any thoughts?
Yeah, and some of the things Dennis was saying kind of made me think back to the process of going through the podcast and figuring out topics and experts to talk on that, which makes me even more excited for season 2. We've already got some really amazing guests lined up. Faith-based leaders from India that are making a difference, helping women. We're going to do an episode on transgender organizations in the community. But as far as one thing that stood out as sort of a aha moment for me was back in episode 1, and Michael has said this before, but the way that the world responded to COVID-19, and Dennis and the communications team, we've talked about this, of how long a road it is to actually make a change in the public health architecture. Global public health can't be run like an afterthought. And that's the one thing we were afraid of when the pandemic hit. The longer it takes to make any changes, the world's going to forget what happened. And when Michael said that it's got to be run with the same seriousness and coordination as nuclear oversight or air traffic control or world trade, without something like that, without complete cooperation with all the countries in the world, it's just not going to work. And that's why we're really glad to see the AHF Global Public Health Institute pushing for regional and global cooperation, because without it, we're just going to keep repeating the same mistakes. But tying global public health to the main pillars of what countries agree on to cooperate on, that was a light bulb moment and something that I would love to see happen.
Yeah, you raise very valid points there in terms of the discussion around it. And yeah, the work that the Public Health Institute is doing, I know that somewhere in our future seasons, we'll get to unpack that a bit more. It also speaks to AHF's creativity and innovation, the ability to have a foresight as to where the world is going and how we need to meet it there. We don't have to wait until it happens. We need to be prepared for it. So it speaks to our work generally, even with the Public Health Institute, and what we're doing with the regional approaches, what we're doing even in discussions around strengthening responses or engaging key sectors or key institutions, even at the national level as well. So it's good to hear that you align with those sentiments, and you had already started talking a bit about what our listeners should look forward to for season 2. And I want to stay on that a bit before we go back to something else that I'd like us to talk about, which is the work that happens behind the scenes that most people don't get to see, the heavy lifting. So let's talk about the future for us. Season 2, Brian has started us off. Dennis, I want to know if you wanted to chime in. What are the lessons from this that we're taking in, and what more can our listeners expect?
I think the biggest lesson is we need to do more of what has worked. This was a learning season for us. I think listeners have more dynamic conversations to look forward to, more engagement. Of course, we are trying to grow our audience and bring this to a wider audience so that they can enjoy this and find out about all the good work that's happening. And I think more, just more of the good conversations and more of the voices that people are not hearing. So bring to the fore people who don't necessarily have the opportunity, who don't make the news stories. But, it's incredible with, how much can be done and how much impact can be achieved at a ground level with not a lot of money, but with a lot of passion. If you find people who are passionate about it, like we heard, the youth advocates, that's where the real change begins. It's always at the grassroots level. So I think that's what we'll be focusing on.
Absolutely. So on that note, I'd like us to take a bit of a break to just segue a bit into some rapid fire questions, and then we'll come back and close this out. And it's just, again, still on our inaugural season. And I'll be asking you a couple of questions. I'll go alphabetically so at least you know where you fit in the alphabet. So I'll start with Brian. Describe season 1 in one word.
I would have to say eye-opening. And it's hyphenated, so it's one word.
Okay. Cyan, if this podcast were a song, what genre would it be?
Jazz.
Dennis, Do you use coffee as fuel or late night editing as you worked on the podcast?
Coffee.
Olivia, if you could rename season 1, what would you call it?
Rebellious.
Rebellious. Okay, that's a good one. We're righteous rebels at the end of the day. Brian, if we could have one celebrity guest on the podcast, who would that be?
Magic Johnson.
Oh, wow. This is some great. Cyan, what is one topic you'd like to see discussed?
Well, of course, the Global Public Health Institute.
Okay, great. Dennis, if this podcast were a book, what would the title be?
Breaking new ground.
I like that one. Breaking new ground. And then Olivia, early planning or last minute magic?
Early planning.
That's a good way to segue into what is life behind the scenes for this podcast. For many listeners who don't know, what does it take to put together a podcast for a global organization such as this? So Dennis, do you want to share with us? What's the day-to-day like?
Thanks, Kemi. A lot more goes into it than it seems. So from a listener and viewer perspective, you just log in and you get this beautifully polished product. In reality, there's a lot. It takes a lot of time, a lot of coordination. As I mentioned before, it takes an incredibly good host and a good production company and a great communications and marketing team. So it's a very deliberate process. You don't just sit down and decide, okay, I'm going to do a podcast and you start doing it. Consistency is also key. You need to have all the pieces lined up and in place to have it come out consistently at the same time and to build that trust with the audience.
Thank you for sharing that. Brian, what was your own experience behind the scene that most people don't know in terms of, how it all comes together?
Kind of piggybacking on what Dennis said, just don't know what all the planning that has to happen before you hit record. And I got to give Kemi and Dennis kudos for that because we're coordinating schedules across time zones. You're figuring out what expert guest is going to mesh well, not only for the topics at hand, but also how the listeners are going to receive them. And just keeping everything organized, and the team did a great job as far as that goes. But if like Dennis was saying, if it seems seamless in the final cut, then it's being done right.
But there's also a lot of brainstorming session that goes into this, though. And I know even Olivia, Cyan, we've had, those sessions where we brainstorm. So do you want to share about it?
Kemi, that's actually funny that you brought that up because the brainstorming was the first thing that popped into my head because before working on this podcast, I really thought that people just went into a meeting, they listed down ideas for topics to talk about, and that was it, a very cut and dry situation. And it's anything but that, because I don't think that you really see how collaborative the process is. I mean, we have multiple meetings for brainstorming, but we also, bring it into staff meetings that we have and let the whole team collaborate on it. And it's great to be able to see everyone's point of view. And by expanding it like that, you're able to see viewpoints that you didn't see at first, and different sides to stories that again, you didn't see. So I think that was really new for me. And also the pops of creativity that you get with doing like mundane tasks. Like I know that I hear from Dennis and he's like, I was folding laundry or I was in the shower or something, and I thought of this great idea for, an episode or something. So I don't think that you realize that it doesn't stop when your 9 to 5 is over. It's something that's always in the back of your head thinking.
Yeah. And it's also the deep breaths you take. I'll speak for me before you come on each episode. And the fact that we coordinate across time zones. And sometimes we're recording so early or guests have to be up so late to get on the podcast. So that's the beauty. And that's why they say it takes a village to do something like this. Because most times people just think it's you setting up a big boom mic with a ring light and action. And you start talking. So it's also the ideas, the conceptualization, the questions. What do we ask? How can we get the most out of our guests? And who do we pair with? Especially most of our episodes have had 2 guests or more. How do we bring them together in a way that they can feed off each other, but their experiences also complement? And it's a lot that goes into it. And I have all of you to thank for the amazing and incredible work that goes into this podcast and what we've been able to do in the first season. But there's also the admin side, the operational side, which Cyan, takes care of. There's a lot that goes into it. And I'm happy that we're having this conversation today, because sometimes it's also good, even if you're behind the scene, to come in front of the camera and have these conversations with our listeners. So now I'm just thinking, as we prepare for season 2, I am beyond excited, because the first season we had dynamic topics, but I think season 2 even has far more dynamism to it, where we start off with faith-based leaders and go to trans power and look at media and all of those things. And I'm just thinking, as we wrap up season 1, I want to ask each of you, in a moment of reflection, why does this podcast matter, especially now as the world navigates global health challenges, as we're pushing for a new global health architecture?
I think it matters because, we're not just talking about global health. We're addressing who actually holds power and who gets left out. And it goes back to us talking about the voices that are going to be heard through this, whether it's big policy level stuff or grassroots advocacy. And that's the main aspects of why we're pushing for that new public health architecture, which started back at the early days of the COVID-19 pandemic. So we've been at this for a while, because too often decisions are made far removed from the communities that those decisions affect.
Cyan?
Yeah, I think I always go back to the title of our podcast, which has the word revolution in it. And I think people and our listeners are looking for hope and representation. So it's nice when each episode touches on each of the different facets of global public health. And I think that they're also looking for trust. They want to believe that there's an organization or a community out there willing to challenge the status quo and advocate for human rights and actually move the needle in healthcare. And I think the podcast itself is something tangible that people can share. And it tells listeners and their friends and family, you're not alone. People all over the world asking hard questions and pushing for change. And at the end of the day, people who are out there in power, promoting poor policies, these aren't demigods. They're not Marvel evil characters. They're just people. And we're people too. And we're advocates. And then that means we also have the same power to push back in that way. So I would just keep on advocates, do your thing.
Great. Dennis?
I think this podcast is really important because, again, we're taking a different approach. Yes, we acknowledge the fact that global public health is going through a very turbulent time, but we deliberately choose not to wallow in that negativity. We say, yes, there are many problems. This is what people on the ground are doing about it. And I think, again, that's a breath of fresh air. And my hope is that will inspire people to take action and just not be, distraught about in any crisis. There is some opportunity to change the situation for the better. And I think that's what we're trying to do with this podcast.
Thank you. Olivia, let's come to you.
Yeah, I think a lot of our answers have, a common thread, and I'm going to sort of follow that because I agree with all of it. I think that this podcast is able to give everyone a seat at the table when it comes to public health. And we're hearing voices from people on the ground in those grassroots organizations, and hearing what their views are and what they think needs to come next for public health around the world. And I think that's what we need more of right now.
Yeah, I agree with all of you in terms of why this matters, and leveling the playing field, because you can't have policies that are made in isolation if the people whose lives will be affected by those policies do not shape the policies themselves. And that's something we're doing with this. So it's really refreshing to hear, because I hear words like inspiring, I hear words like power, I hear words like the voices of grassroots and even decision makers, and bringing them into that same space. And I look forward to us being able to continue to do more of that and give more space for those who do the work on the ground to also have a voice to say, this is from our experience, this is how we can move global health further and make it more progressive, make it more inclusive, representational, and of course, more impactful as well. So I just want to thank you all for taking the time to join me in this conversation. And I look forward to us having another conversation again when we look back at, who knows, maybe season 3, season 4, season 5, 6, 10. I look forward to us just being able to reflect on the work that has been done, and also for the benefit of our listeners. So thank you very much for coming on. And there's nothing more to add. Stay tuned for season 2. You don't want to miss the conversations that we will be having and how we continue to spark real change, whether it's in advocacy, policy, or even creative marketing. Until we come your way again, thank you and bye-bye. Thanks for being part of the global public health revolution. We hope today's conversation left you inspired, challenged, and ready to shake things up. If you loved this episode, don't keep it to yourself. Subscribe, leave us a review, and share it with your network. Let's keep the momentum going.